Apex beat or the apex impulse or the cardiac impulse is important part of the cardiovascular system examination. This represents the mitral area on the precordium. Now, what is apex beat? Before we go on to see that, we see a small video.
So now we are going to see a young patient. He's a 20 years old male who has presented to us with hypertension. Now when you see the chest, you got an interesting finding. When we examine the chest from the profile, we see that this part of the chest is slightly more bulging than this part. There are multiple superficial veins and you can see the apex beat. Now it's present in the fifth intercostal space, but it's outside the mid-clavicular line. And when we examine, we find that this shows a very well sustained heaving character. This is classical of patients who got pressure overload, that is aortic stenosis and chronic hypertension. They can both produce this sort of an apex beat. This patient doesn't have any parasternal lift. We can feel that the second heart sound is slightly loud in the pulmonary area. So is a little bit of feeling of the aortic component of the second heart sound, but the pulmonary component is quite easily palpable. So
now we see this apex. This patient has a slightly bulging left side of the chest because possibly this patient has chronic hypertension, and which is called hypertrophy of the heart, and the left side of the chest is slightly more prominent than the right side. This patient has chronic uncontrolled hypertension. We still are going to do not know the cause. We are going to investigate what's the cause of his hypertension. He is a juvenile hypertensive. There are hypertensive changes in the fundus indicating that patient has chronic uncontrolled hypertension. There is a little bit of pulmonary hypertension on the clinical examination which still needs to be investigated. So this patient has one thing, is chronic uncontrolled hypertension, which has caused hypertrophy of the heart, and you can see an apex beat or apex impulse which is showing well sustained character. Now what is apex beat? When you see apex beat, by definition, it's the outermost and the lowermost part of the precordium where there is a definite cardiac impulse. So the more important word is the definite. It's not the maximum cardiac impulse. So the area of the precordium where there is a definite cardiac impulse at the farthest place, that it's the outermost and lowermost part of the precordium. If an impulse is there, you can definitely feel it. This is the apex beat representing the mitral area. The maximum intensity may be present in a different area, but you have to see when you can feel a definite cardiac impulse farthest away in the lowermost and outermost dimensions. This is the apex beat. This is generally present in the left fifth intercostal space in the mid-clavicular line. It may be slightly to the left or to the right in patients who've got situs solitus. If they have got situs inversus, this may be present on the right side. So when you don't find an apical impulse on the left side, always turn the patient to the left, try to feel it, and if you can't find it, go and examine on the right side as well. The patient might have dextrocardia. Now, how the apex beat is formed, this is an interesting phenomenon. It's according to the Newton's third law. When the left ventricle pushes the blood towards the aortic valve is closed initially, and when the pressure rises, the pressure of the left ventricle is on the blood. The blood responds to it by an equal and opposite force according to Newton's third law. So this is how the apical impulse is produced. So it is in reaction to the push given by the left ventricle on the blood pushes back the left ventricle, producing the apical impulse. Now, what are different characters of apical impulse? The normal character is that it's present in the left fifth intercostal space and slightly taps your examining palm or finger. And then there is another term which is called tapping apex beat. Now, how this thing is different from the normal tap we described for the normal first heart sound? This tapping is actually the palpation of a loud first heart sound. So this gives you a loud tap on your examining palm, and once you've examined it, you cannot forget this feeling. This is seen in mitral stenosis with a pliable mitral valve, which is not calcified. If this starts getting calcified, this character starts fading and disappearing. So a loud first heart sound just indicates pliable valves. And this may sometimes be seen in patients who got tachycardia. And then the second important character is the heaving apex beat. Heaving may be well-sustained heaving, or it may be ill-sustained heaving. The well-sustained heaving is that the apical impulse lifts your palm throughout the systole, that is from the first heart sound to the second heart sound. This is seen in pressure overload situations like aortic stenosis and uncontrolled chronic systemic hypertension. And then you got thrusting or ill-sustained heaving apex beat, which is slightly more diffuse as compared to the well-sustained heaving apex beat. And in this, the palm is lifted but not throughout the systole, only on some portion of the systole. And this is seen in conditions like volume overload caused by aortic regurgitation or mitral regurgitation, and in some patients with heart failure as well. So we've got a normal apex beat, we've got a tapping apex beat, and we've got a heaving apex beat. The heaving apex beat, which is well-sustained heave, may be present in normal position, or it may be shifted slightly to the left, while the ill-sustained heaving apex beat may shift downward and outward as well. So this is about the apex beat in brief.